Welcome to the Health System CIO Show. I'm your host, founder, and editor, Anthony Guerra. On today's episode, I'll be speaking with Sam Jacques, VP for Clinical Engineering with McLaren Health Care. Sam, thanks for joining me today.
Oh, thank you, Anthony. It's a joy to be back.
All right, very good. Appreciate that. Let's start off with a little bit about your organization and your role, and you could also talk about your work with the HSCC because that's going to bear a lot on what we discussed today.
Sure. For my day job, I am the vice president for clinical engineering at McLaren, which means I manage all the medical equipment in a 13 hospital system in Michigan. But in my free time, right, I am the vice chair for the Health Sector Coordinating Council, which is part of the public-private partnership, right, with the U.S. government and the health sector, right? We generate all kinds of great guidance for all kinds of health sector partners, including providers, as well as medical device manufacturers, laboratories, pharmacies, all kinds of organizations so that we can move cybersecurity forward, right, as a sector.
Yeah, it's very interesting that someone in your role has that prominent position at HSCC, and it speaks to the importance of the areas that you're responsible for and the growing understanding of everything that's going into biomedical devices, especially as we talk about cyber resilience and things like that, all the challenges that come into play around securing these devices. It just seems to continue to elevate. Thoughts on that?
Yeah, medical device security, of course, has been very forefront in thought for the last 5 or 6 years.
Right.
But now that we've layered AI on top of it, right, it really has become something that a lot of clinical engineering, biomedical engineering departments really have to pay attention to, right? Trying to merge, right, departments in IT, cybersecurity, right, with clinical engineering is something that needs to happen more and more so that we can protect, right, and defend, right, all of our organizations against all the threat actors that are out there.
Yeah, it seems like, when you have these areas, everyone likes to organize things in buckets because it's easy, right? I mean, that's what we need to do in our lives. We need to categorize, but it's when things belong in multiple buckets and there's overlap. Let's say you're doing folders on your computer, and you're doing fine, and then you realize, well, this could go in either folder. So then you go, all right, well, different tools out there let you apply labels. So then you could apply multiple labels to something. So that kind of helps, right? And that it makes me think of something like biomedical devices and biomedical security. It's in multiple areas. It doesn't lend itself to just being isolated, which is very easy and categorized. It's got to have over those circles, those Venn diagrams with all the
Yes,
circles. Like when you
exactly.
got a lot of circles overlapping, that's challenging. And we've been in flux with where it reports, who it reports to, how much do they like reporting to the CISO? Do we see ourselves as clinical people? And why are we reporting to IT? There's so much human stuff that goes into this. So wherever you want to go with that.
Yeah, I mean, it's complicated in a lot of ways, right? Not only do you have just normal support from a clinical perspective and a lot of touch points with the clinicians, right? You need to be able to understand then, to your point, all the rest of the Venn diagram. So how do we layer with networking? How do we layer with IT? How do we layer with security? And so you become almost a subject matter of nothing, right? And an expert in nothing, and you know a little bit about everything, right? I like to think of my department as one of those departments that's actually like a translator between every other department, right? We help IT translate nursing. We help other departments who don't necessarily have as great of a frontline relationship build right the bridge between them so that we can continue right to secure what needs to be secured. Sometimes our friends in IT don't necessarily understand the workflow of what's going on the front line, right? My staff are out there day in and day out, right, helping those caregivers actually provide care, right, by ensuring the equipment does what it needs to do. IT folks don't necessarily have that subject matter expertise. And so we lend a hand to try and bridge that gap. And so I really think of it much more about layering on, right, how to support an organization in a very layered mentality, very much like security, right? We want a very layered security posture. And so we're just adding another layer to that kind of lasagna to say, right?
Yeah, it's good.
We really
Yeah.
need, right, to all work together in a way to not only secure our environments, but also provide, right, plain old care to people coming into our organizations.
I love that. The security lasagna. It's great. That's right up there with the Venn diagram with
Exactly,
a lot of
exactly.
circles. So yeah, that's security in depth, right? That's an expression. Um, I'm gonna jump around here just because it's what I'm thinking of. But we're probably gonna talk, or we could talk a little bit about. And again, this may get out of your sort of wheelhouse and into more of the CISO conversation I'd have with the CISO when we talk about network segmentation. And the only thing I'd like to bring up in that area is it seems to be one of the primary controls for these kind of devices is if you can't secure the device itself because of the limitations of what you can do with it, uh, because of the way it's structured and the requirements by the makers, the device makers, then you want to isolate it. But one of the interesting things, at least this is what I think I'm hearing, is that when we talk about these mythos level attacks, uh, and I could be wrong here, but I may have been reading that that can limit the effectiveness of network segmentation. And I wonder if you have any high level thoughts on that kind of network segmentation, and if you've heard anything to the effect that some of these beyond advanced, we just saw the US government just squashed Fable 5 and shut it down. Crazy stuff going on. So any thoughts there, either between network segmentation and some of these advanced frontier model tools that seem to be perhaps starting to break some of the established rules around security or beliefs?
Yeah, there's a lot of stuff going on, right? So you're exactly right. Medical devices are very complicated to try and secure, right? We like to think of frontline defense as patching, right? But we all know medical devices don't necessarily patch very quickly or effectively, and so we rely on compensating controls very, very early to try and get that layered security in. And so, right, a lot of organizations implement broad network security, right, in layered networks, right? So we segment off, right? I'm going to make it up. We segment off all our imaging devices so that imaging only talks to PACS, so that right, we try and protect that segment
Right.
of our network. I will say, right, a lot of the frontier stuff that's coming out about AI is showing us that AI has the ability to put together really, really complex types of attacks. We historically, right, organizations have only focused on critical and high type of KVIs, KVAs, so that we can prioritize the amount of work we need to do. What frontier models are showing us is you can take lows and mediums and concatenate them in ways that we have not thought of in the past to get past security defenses that we currently have in place. Do I know that that's going to break segmentation today? I don't know because we don't know what's out there. We don't know what's coming. But can I envision that that's going to happen? Absolutely. And so we need to start thinking about other ways to secure, other ways to segment. I know a lot of organizations are looking at micro-segmentation, right, as another layer. Obviously, that continues to try and reduce the blast radius if something goes ahead and occurs, and reduce, obviously, the organizational impact if something occurs. But it's a lot of overhead and it's a lot of cost and it's a lot of maintenance to go ahead and continue to maintain. And so there's a balance, I hate to say, with every piece of layered security that you put in to try and understand, right, the cost versus the benefit on what you're trying to protect against. And so it's really a new world. And to your point, it changes every day, right? This weekend, something changed, and we're all now trying to scramble to figure out exactly how, right, to react to it.
Yeah, yeah. One of the guys I follow, one of the AI guys I follow, I wake up Sunday morning or something, and he's like, it was this sort of cryptic, kind of vague tweet, or I guess X or whatever we call them now. I'm trying to figure out what he's talking about, and so then I'm just bouncing around. And it's like, oh, they released Fable 5, and then the government was like, no, no, like. So
Shut
now
it down.
if you go into Claude, there's a little message right there for every Fable 5 is not currently available. It's just wild. You're like in this thing in real time. And there's real and I read an article about sort of what happened as much as they could say. And there's real time conversations between like Anthropic and the White House and discussions and it's fascinating. It's almost like you're right there as this is happening. And as a security professional, that's even well. I read a great article last night. I'll just bring up where somebody said this is kind of interesting because if we weave these things into our work, into our workflow, into our organizations, and somebody pulls the plug, right? Somebody shuts it off. That could be really like we can't have this happening if we integrate these things into our workflow. Anyway, your thoughts?
Yeah, no, I completely agree, and I think I'll have two thoughts here for you. So the first is around how Anthropic is working with the government, right? We know that when Mythos came out, right, Project Glasswing got spun up, and there's been a lot of
Yeah.
work around organizations, not only private entity organizations, but also the U.S. government, working with them to try and understand how AI, right, can really kind of get pushed out in a way that's safe and effective. I don't know what happened in the background related to Fable 5. I can't tell you exactly right what people saw or what happened, but I do think that there are a lot of conversations going on in the government, and as part of HSCC, we hear about some of those and we partake in some of those to try and help right ensure that critical infrastructure is protected in a way that needs to be protected. But on your other point, right, I do think, right, as part of HSCC, we've recently released about a month and a half ago a third party document around AI, and one of the pieces on third party choice, you're picking and choosing which AI you implement into your organization is the end of life question, the exact question that you've asked, right? How do you choose the appropriate AI so that if something changes and they choose to end the model instantaneously, right? Right, or upgrade or make some ridiculous change that you can't actually adopt. How are you going to actually react to that? Those of us that live in healthcare, we're used to stuff that changes in a 3 to 5 year time frame, or in medical device world, it's 7 to 10 year time frame. We're not used to like Monday morning, this is
No.
changing type of time frame. And so having downtime plans, having backup plans, right, having a workflow that is actually flexible, we're used to figuring stuff like that out. The thing that's changing is the time frame in which right we have to be able to react, and that's really what a lot of organizations are struggling with is we used to have time to make these decisions, we used to be able to plan what the next step is going to be, and now we don't necessarily have that capability. We're having to make on the fly decisions and changes, and I'm going to tell you, organizations that have good AI governance models, organizations that have good plans are able to adapt well. Organizations that aren't, right, are struggling. And so, like I said, there's a lot of guidance out there. HSCC has been putting out a lot of guidance to try and help those organizations because AI is changing everything very, very rapidly.
Yeah, it's fascinating. It's just a couple things come to mind, as you were talking is one is sort of just a crazy dynamic at super high level is just like what's first of all, to even use the word fair sounds silly. I sound like a child to when I talk about it's not fair. But when I think about how Anthropic is rolling out Mythos and things like that, they get to decide who gets to see it, and they get to decide if then they had the small group and then they're expanding it, and now I think they're maybe trying to get away from this vibe of some inside club that you have to get in, but what is fair? I mean, it's a private company. They can do whatever they want. So but they're making these tools that are game changing, and I don't even know. It's not even like you could buy it, and you just usually it's just okay if you have enough money you could buy it. But it's not even that. It's like we'll decide. It's not about money. We're going to decide. So it brings me to things about health systems and access to these advanced tools. And they're certainly not in the discussion, I don't think, of having direct access. It's usually like you're going to get it through your vendor. So that brings me to thinking about, if you're Matt in a job like yours or a CISO, you've got certain things that you can do that you need to do as an organization, some of these advanced capabilities, or to some degree being prepared, is relying on the vendors you've engaged with and them preparing. Like they may be the ones that have access to the tools. So you need to be very careful, which takes us to third party risk management, because these are the ones helping you. They're also one of hundreds of vendors. And that's, I think, Operation Vital Signs is what we're going to talk about today. But it's all very tied to third-party risk management, which has its own acronyms, right? Now, TPRM, right? Third-party reliant, whatever it is. I'm just babbling because there's so much there, but I'm going to let you jump in wherever you want.
No, I think third-party risk management is something that's critical, right, for a lot of organizations, not only those of us, right, in downstream healthcare that are caring for patients, but also our manufacturers, right? So you're right, right? With Anthropic, a lot of us are thinking about how we're going to deal with vulnerability management. We've got to figure out how to patch faster. We've got to figure out, right, how to operationalize things that used to be, right, patch Tuesday once a month type of things now to like a constant patch management mentality. But we're relying on our vendors to provide those patches, right? What are they doing? All these conversations are going on, right, as we speak. All the vendors are trying to figure out how do they get in a mentality to create patches on a much more frequent basis. How do they identify things? How do they remediate things? How do they prioritize what they need to remediate? All of our organizations within the health sector are really trying to come to terms with this deluge of information that is coming to us. And right, correctly so, we're all trying to figure out how to utilize the resources we have to ensure patients, right, remain safe, right? At least from a North Star perspective, our sector is a sector in which we all have the same directionally correct plan. I can't say that's true in the rest of the sectors, right? I'm not a subject matter expert in oil and gas or, right, all the rest of them that are getting into this, but we at least know exactly where we're going from a sector perspective, which is awesome. It's just trying to figure out how to get there. So you're right, working with our vendors working with their vendors, where are they getting their software from, what partners do they have to create right, their internal software mechanisms to go ahead and create stuff. What kind of resources are they trying to pull together? And a lot of them are trying to work together, right, because they utilize the same software libraries and such, so that, right, we don't need to be recreating the wheel, organization to organization to organization. I think that's really powerful for a sector to try and do. I also think from a third-party risk management perspective, we as a nation need to start thinking at a much larger level, right? We tend to think at a very organizational level. We think about our stockholders, we think about, right, how much money we're generating. We don't necessarily think about the sector. And so I think our sector in general, right, really tries to work together so that we understand the entirety of what's going on from one end to another. So that we can actually try and optimize how stuff moves through, right, the entire system. And to your point, right, we're going to talk about Operation Vital Signs as one of the things we're trying to do to try and optimize exactly what's going on. Because we know things like AI and right, all of the threats against our sector are happening, and we need to be able to prepare for that. Other sectors, right? Finance sector has been doing stuff like this for years, but not all sectors are at the same kind of place. And so we need to be prepared as a nation, right, to really wrap our heads around, right? AI is going to bring all of these risks, not only to the health sector, but to other sectors. And we need to really prepare for all kinds of different kinds of downtime, right? And figure out how to get around some of that so that we can continue business as normal, whatever your business is.
It's crazy. It's crazy. These medical devices. So there's a couple of things here. I think about this. What's very unique in your world is, to my understanding or my basic impression, is there's a fairly small number of manufacturers that make a lot of the global medical devices. So usually individual organizations have zero influence over those manufacturers in order to get anything changed or upgraded or different. So you've got your relationship with those device makers to some degree, if at all, but it's such a huge risk, I'm thinking, to the sector, because if you have a small number of manufacturers that are pervasive, and there were to be a mythos fueled attack that was able to take out that class of medical devices across the sector, that would be pretty scary.
Well, I think, and I don't want to call out Stryker specifically, but right recently we had the Stryker downtime, right? And that wasn't Mythos fueled, that wasn't right
Right.
AI fueled, but it was something very similar, right? Where a global medical device manufacturer, right, had an issue that impacted a very large right portion of the sector. Was it a massive impact from a sector perspective? No, right? We were able to figure out exactly how to operationalize, right, and continue on with what needed to happen. Stryker was very forthcoming with the way that they handled the event, right? They communicated very well during the event, right? So that downstream organizations knew exactly how to handle it and what to do. I think there's a lot that we learned from Change Healthcare, right,
Yeah.
years ago, so that organizations can continue to hone all of their security posture and help the rest of the sector out. I think there's things we can learn from Stryker that will help us in the next, hopefully never, Mythos event that I'm sure is going to happen.
Yeah.
But I will tell you that the sector is very complex. And so a lot of us worry about, right, these hidden dangers from these large interconnected organizations that, we worry about. We call them organizations, sometimes hidden organizations or organizations that are choke points in our sector,
Right.
that aren't necessarily very well known to organizations as a risk. Those of us that use Stryker, which is practically every hospital in the United States, we know that Stryker is a very large organization. We know that we use them right across multiple service lines right within the hospital. They're a known entity. The ones that are unknown are the ones, truthfully, that worry me more, right? Those hidden entities like a Change Healthcare that we didn't necessarily at the time know that they had such an impact, right, to the daily operations. That truthfully worries us more than a very large multinational, because we at least know from a multinational perspective exactly what they have, and we can figure out exactly what the impact's going to end up being and how to mitigate that impact.
Yeah. So you tell me if I'm right. What I'm thinking is, with the Change Healthcare example, we had a choke point of flow, of business flow of technology. Everything was flowing through one point, and when that point no longer worked, we had a big problem. And I remember from studying this at the time and trying to understand it, you could theoretically have a backup relationship established with another company, and perhaps you had just that ready to go. And I don't think there would be a lot of cost in doing that. It's sort of creating potential as opposed to buying. But you can't have a duplicate fleet of medical devices from another vendor sitting there in the closet ready to go if you could no longer use a particular the devices that you had rolled out. That's not cost feasible, I would imagine. So it doesn't work that way. You can't apples to apples it. It's you have to get those, take them offline perhaps, which is a patient safety problem, and then have them remediated and repaired and stuff. But these are not scenarios that anyone wants to think about because I don't even know what you do there.
Yeah, and truthfully, it depends on what the attack looks like, right? A lot of manufacturers have designed their medical devices in a way to work offline, right? So we'll take a physiological monitor, for example, right? The monitor itself can actually function offline. You
Uh-huh.
lose some ability, right, to go ahead and monitor at a central station, to oversee a patient, right, in a war room, perhaps. And so, yes, you need more staff. Yes, you need, right, additional FTEs to go ahead and assure that people have eyes on the monitor so that you're caring for the patient. But unless you physically get malware into that actual monitor, you can still take care of a patient,
Okay.
right? Are there ways to get malware into every monitor in a hospital? Probably. Is the likelihood of that, gonna happen? Maybe not, right? The risk in my mind is not necessarily as high. It's much easier to take out the server. It's much easier to take out, right, the infrastructure so that I've got to pull it offline and we have to work in a local mode.
Okay.
Most medical devices will work in a local mode. It's just not as convenient. The workflows are very, very difficult, and you end up
Right.
having to add a lot more labor and a lot more time to go ahead and utilize them, which of course is, again, downtime planning and assuring that your organization is ready to work in an offline type of mode, which a lot of us now are getting ready to do, right?
Yeah.
Just based on the way that the world is working today with our threat actors.
Yeah, so to your point about scenario planning, this is a really important issue when you're doing, and we can go into vital signs now, Operation Vital Signs, but to me, the first issue you have to solve or address when you're trying to do this is what scenarios are we going to plan for? What do we think, what is the likelihood of something happening? And how much does it cost to prepare for that? And is that reasonable for us to make an investment in preparing for that scenario? Perhaps a scenario is so unlikely, so catastrophic, but so unlikely and so expensive to prepare for, it would make no sense. We're not going to do it. If it happens, it happens. Hey, but right? It's like buying insurance. Insurance costs money. Now, you could have a big payout, but the chances of something happening have to warrant the payout. So when you're trying as an organization to do resiliency planning, you need to plan for, you don't just plan in a vacuum. You plan for scenarios. You could plan for different scenarios, but they all have to be somewhat reasonable and worth your time and effort and spend. What are your thoughts there?
Yeah, so a lot of organizations use a mentality called a hazard vulnerability analysis, right? Where we'll look at all kinds of hazards, not just, right, IT, cyber type hazards, but all kinds of hazards, right? A lot of us are dealing with weather related hazards now that, right, a lot of the climate change is changing the way weather is happening. And so we have more hurricanes, we have more weather events, we have more flooding, wherever you are, right, in the United States, you're dealing with those types of events. And so whatever your hazard profile looks like, you take that and you create the list, to your point, right, of the likely events that might happen. Supply chain interruptions is obviously one that raises to the list of a lot of organizations. How do we deal with major supply chain changes or interruptions? And a lot of that may have a cyber background or may not have a cyber
Right.
background. Does
Right.
it really matter how we got into, right, a supply chain disruption? Probably not. But guess what? We're going to figure out how to go ahead and be resilient to that kind of event. I'm going to tell you organizations that go through a very robust hazard vulnerability type of analysis really think about what their downtime plans need to look like. And so in the cyber world, you might have an analysis of where your software lives, right? And so, right, an organization may look at what clouds, right, you live in. Okay, if I've concatenated a lot of my software into a particular cloud, perhaps I want to plan for a downtime of that cloud. Or, right, if I use an integration vendor and 90% of my stuff goes through that one integration vendor, I need to have a very robust downtime plan if that integration vendor goes down and it happens to be in a cloud or something. Those types of plans where you've concatenated a lot of risk in one place is definitely something organizations look at and go, well, this is something I really need to plan around. But to your point, right, in a Change Healthcare world, if I have the ability to flip a switch and move
Right.
somewhere else, right, with very low risk or very low money, right, or something that's not a huge impact, that is something that generally falls very low on your hazard vulnerability analysis. And if you've already got a backup plan, right, and it doesn't take a lot of money or a lot of people to go ahead and implement, that's not something that a lot of organizations spend a lot of time worrying about. They worry about the stuff that they may have to put a lot of effort and energy into putting a plan around or finding insurance for, right, creating some massive resiliency effort towards remediating.
Anything else you want to talk about Operation Vital Signs?
For those of you that aren't aware, right, what we're talking about, Operation Vital Signs is a 2-day event, cyber response event that the Health Sector Coordinating Council and HISAC is putting on. It is July 21st and 22nd. If you want to sign up, go out to HISAC or go out to the HSCC website, and it sends you to the website to go ahead and sign up. It is available for anybody in the entire sector to sign up. So we are doing a nationwide exercise to try and test resiliency from a nation perspective, so that organizations can actually prepare for a nationwide type event, right? Whether it be something like a Change Healthcare, so that we can respond appropriately. So not only can you practice as an individual organization, which is generally what day one looks like. Your organization can utilize, right, the scenario that we're putting in place to practice what your individual organizational response is. But day two is very much around how do we as a nation respond, right? What is the local government response? What is the national government response, right? What is HSCC doing, right? What is AHA and some of the other organizations trying to get together to provide information so that nationally we can go ahead and deal with issues that affect more than one individual organization. So it is a great event. If you guys haven't signed up, I highly recommend you going and signing up. I do want to say sign up closes at the end of June, so you have just a little bit of time to go ahead and sign up, but it'll be a wonderful event for us to practice because I will tell you, right, practicing makes perfect when it comes to cyber resiliency.
Well, it's 100%. It's 100%. You want to have some muscle memory here. Um, that makes me think of tabletops and all the different things people try and do and prepare. And one of the key issues that comes up there a lot is it can be extremely difficult to get buy-in from operational leaders to get them to spend half a day or a couple hours to do this. Any advice there on getting that engagement?
So I will say, right, from an engagement perspective, cyber folks are having a lot more luck, right, depending on, right, how aware your organization is to stuff going on, right, in the global environment. To
Right.
your point, organizations and even operational leaders are becoming much more aware of not only cyber threat actors occurring, right, in healthcare, but now, right, you can start leveraging all the AI stuff we've been talking about, right? We're really worried about what's going on for AI. A lot of us have been worried about, right, global events that have been happening, right, the global wars, right, how threat actors in other countries are trying to impact, the U.S. All of that kind of risk has a place, and our operational leaders need to understand that that may impact us, right, on a very local level. And so, right, having those conversations so that your team can be prepared, especially, I hate to say, in the third party world, right? The threat actor may not be after your organizational directly, but I will tell you, right, if they take out a large third party, you guys will be in the blast radius and you need to be able to react to, right, having some impact from that third party. Because, right, we're all so tightly woven together, right, in this health sector from an ecosystem perspective.
Yeah, so, I was just thinking as you were talking, like, there are so many scenarios that can happen. There's a million different scenarios where you could have a resiliency issue where things need to kick in. So to me, the most important thing is creating the structure in order to address the scenario rather than trying to make sure you have a particular scenario addressed ahead of time. Because again, there's so many things that could happen. So you need the infrastructure in place, the governance in place to say, if something happens, here's what we do. Here's who gets in a room. Here's who is going to have the discussion. And you could bifurcate that between cyber and non-cyber because cyber, you're going to involve your cyber insurance company and the FBI and law enforcement. So that could have its own flavor and probably require people to be there that don't need to be there if it's a hurricane situation, right? So,
Sure.
but you just at the very least and understand something about how the decisions are going to be made and who's going to make the decisions. And to me, this always elevates to a CEO level. I would hope, like when you have these discussions about decisions that need to be made about patient diversion or whatnot, or taking things offline and accepting risk, that it almost always seems to it's going to have to hit the CEO level. So that would be my thought is you need to understand and the CEO needs to be briefed on, hey, this may sound like an IT issue, but you're going to need to be in the room because some of these decisions are going to get to your level super quick.
Yeah, and the same with the clinical folks, right? A lot of the time, right, our IT run books really focus on the technical aspect, right? I need
Right,
to shut down this VPN. I need to,
right.
right, cut off services. I need to go ahead and segment this off really quickly. And they don't necessarily go to the clinical implications of what that
Yeah,
needs to look like. And so to your
yeah,
point, right, the structure is very important on who sits in the room as we're talking about this stuff, right? If you don't have the appropriate group in the room, you might run off down some technical path and not understand how you need to communicate, right, over to the clinical side or even over to the marketing side, right? If you're having clinical impact and you're not talking with your marketing folks, right, you're going to get calls, right, from the news companies around what's going on and, right, am I canceling cases? And,
Yeah.
right, all of the pieces that you need to pull together from an emergency management perspective, from
Yeah.
a senior leadership perspective, from a governance perspective, all need to be worked out well before any
Yeah.
event you have.
Yeah, and I think you just hit the nail on the head that I've sort of been dwelling on for a few years now is that real-time interplay between your cyber insurance carrier, the FBI, your CEO, your COO, your CFO, your CIO, your CISO, your chief medical officer, your CMIO, marketing, all these, the real-time interplay between what's going on from a technology point of view, what may or may not need to be taken down now or 20 minutes from now or a half hour from now, what that means to patient care, understanding, like you said, the clinical leaders in the room to be told, hey, if we have to do this, what do you have to do? What's going to change, especially around patient diversion, because that's not a black and white issue. It's, well, who's going to be diverted? Everybody, some people, different clinical conditions. Are there people we can no longer take care of who need to be transferred from our facility? And that can change minute by minute. So even I'm talking about things going down. There's also the things coming back up process of who can we take back? Who do we stop? They're all real time interplay. It's fascinating. But you're right. It depends on all the people in the room understanding that we're going to have this kind of interplay.
Yes, definitely. And I think the one group you've left out then is the finance team as well, right? How do I capture everything that I've now done,
Yeah.
right? So that I can ensure the downstream billing happens, that
Yeah.
the downstream pharmacy happens, the downstream, right? All the pieces and parts that generally happen from a finance system perspective actually happens. And so a lot of our teams really need to understand the larger picture, right, on how their system impacts, right, the next system over, so that we're not making decisions, right, in a bubble. And I think that's very important for organizations to understand and to practice, right, and to really have a game plan for, so that we are doing things appropriately. Because to your point, right, if we
Yeah.
ever decide we're going to shut something off and it's going to have a downstream ripple impact, God help us to do a diversion. There's a whole checklist of things that need to happen, not only just from a patient perspective, but from a notification perspective, right? Are we notifying the ambulances? Are we notifying the state, right? Are we notifying
Yeah.
all the people that need to be notified, right? So that everything can happen appropriately and we're not leaving, right, patients out in the cold that absolutely need to be taken care of, right? Our organization particularly, right, has a lot of care in rural areas, and it's a very, very difficult decision, right, to shut down care, especially when it's another hour to the next location for you to go ahead and obtain that care. And so, organizations that have those discussions up front, right, are much more prepared, right, than you making a snap decision and all of a sudden, right, you've got patients who can't get to the care that they actually need, right? That's very, very important, and I'm thrilled that you brought it up.
That's great. It's just it just keeps going because when you talk about this and you think about this, communication with the surrounding healthcare organizations. If you're thinking of going on diversion, you might want to let them know. And what if they're just as affected as you are?
Yep.
So they say, hey, no point in diverting here because we're in the same boat. So again, this is where you could get a little out there, but Change Healthcare affected everybody. If it was a type of thing that affected a region, there's no point in diversion. And as you said, even more fascinating, you talk about distance matters. In a city, diverting is less, it's a different equation if it's 1 mile away versus if it's 60 miles away. Now, perhaps we take patients with more acuity because diverting them is going to be more difficult. So we're going to take on more than we'd want to if there were a health system a mile away. These things all have to be discussed. And as we said, all comes back to patient care. So your chief medical officer is going to be a huge huge decision maker in this or influencer in this in providing the CEO with their point of view, and then the CEO's got to make the decisions about what we're going to do.
Yeah, definitely, definitely. And I think, for systems that are impacted, for right regions that are impacted, it's a very, very difficult conversation, right? What can you provide? What can't
Right,
you provide? And if the technology is impacted, right, how do you go ahead then and optimize the care that you're providing, right, so that you can get back up and running as fast as feasibly possible, right?
right,
And so a lot of the downtime planning, right, goes into that. A lot of the systems that you have that have backups and all kinds of stuff. Sometimes it's not about, right, can we divert? It's about how fast can you actually get back up? Because, maybe 30 minutes, right, is not horrible for us to be unable to do something. There are things that obviously you have to have constantly, but
right,
maybe I can get away with it without 30 minutes. But if I can get back up in 30 minutes, then great. That's going to be the plan we're moving forward. And I mean that takes a very difficult conversation between clinical folks,
right,
technical folks, right?
right,
It is everybody in the room all at the same time throwing out right what the next step is going to be, so that we all have the right path to move down.
right, right. Very good. Lots of decisions to be made there.
Mhm.
Um, so yeah, so everybody's trying to prepare, weigh things. This is this exercise. Are you seeing good uptake on this?
Yeah, we have over 400 organizations already signed up, which is actually wonderful, right? And it's everybody in the health sector, right? We've got health systems, right, that actually provide care, right? From very, very small health systems, right? Rural, regional, right? All kinds of very large health systems, medical device manufacturers. We've got laboratories, right? Blood banks, right? Local, state health officials, right? All the way up to the government officials.
Yeah,
It has actually been a wonderful cross kind of group across the nation to try and see exactly what's going on. Obviously, we'll be collecting data throughout the entire event, and there will be a report published after the event on right recommendations, right things that obviously the health sector can get better at. And hopefully, right in the future, we do intend to do this on a regular basis so that we can continue, right, honing, especially communications, right, and coordination across the nation, should something happen, right, at a national level.
any idea, any target date for that report, month, anything in general? I mean, I'm excited. That's right in my wheelhouse. So I hope to help you get that information out.
No, we don't have a target date, obviously, but I will say Booz Allen is helping us, right,
Okay.
plan the event. And as
Mhm.
soon as we've got the report out, we don't intend it to be a super long time, but we want it to be out as soon as possible. And of course, we'll publicize that with you and right all the
Yeah.
rest of the press so that we can get that great information out.
Yeah, it'd be fascinating to see if anything comes up that wasn't anticipated. So, Sam, I want to thank you so much for your time today. This was tremendous, and it's a great issue and a good exercise. So we're happy to get that information out there. So I hope we can catch up with you maybe after the report comes out.
Well, thank you very much, Anthony. And for everyone who wants to attend or right who's already signed up, thank you very much. And we look forward to Operation Vital Signs.
Wonderful. Have a great day, Sam. Thank you.
Thank you.
Bye.